Hi, my name is Emily Iannelli. I've been posting a lot regarding what I've been through. I have to sit down. I can't stand up because I'm anemic. I have anemia, and I'm also now diagnosed with type 2 diabetes. Uh, I have liver problems. I have kidney problems, and pancreas is also an issue. I have blurry vision, so I can't drive anymore. My mobility is compromised. I have to use a walker to get around because I feel dizzy and lightheaded. And I'm having a difficult time, but I'm trying to do my best. I miss my son, who's now in a group home. I try to keep busy. I sleep a lot because I still feel like after a week out of the hospital, I feel like I've been hit by a Mack truck. So I'm trying to get better, get healthier, but it's going to take time. I've been going to doctors. Today I had to have my abdomen, I had to go for an ultrasound so they could look at my organs, specifically the liver, kidneys, pancreas, and the gallbladder. So, being that I have a history now of falling unconscious and that I'm having trouble walking and seeing, and diabetes, I'm not able to drive anymore. So I have a car sitting on the road parked by the house, and I can't even drive it. The only way I can get around now is through family member or Uber. But I only go out now just to see doctors or get groceries or my medications at the pharmacy. And it's a tough battle. I went unconscious. My wife discovered me in the bathroom, luckily. I wasn't breathing. My wife called the police and paramedics. They came to my house and they had to put me on a stretcher. I have no recollection of the next 5 days, including that. They rushed me to the hospital, the police and paramedics in an ambulance, and the sirens were on. They were speeding, from what my wife told me. And I went to Nassau University Medical Center. When I arrived, they immediately brought me to ICU, hooked me up to a ventilator for roughly a week, hooked me on to the intravenous for my medication and to prevent dehydration. And they saved my life. Thank you to the doctors and nurses at NUMC, to my wife, to the police and paramedics, to my family, to my son. It's been hard, it's been difficult, and I'm frustrated because I'm used to being able to fend for myself, get around by myself, drive, walk. Now I can't. I have a dead arm too. Feels like a pitcher who can't pitch anymore, who's got a dead arm. I can't lift much, it hurts too much. And I'm struggling with my bipolar depression also, which is not an easy thing to deal with. On top of that, all of my physical problems. I had to call the AICPA to pay my membership dues, but I had to ask for a reduced fee because of my disability. So they reduced it from $450 to $150. And then I called my long-term disability carrier to tell him, give him an update of my current medical situation. I see my doctors very rarely, except for my main doctor, My other doctors, my liver doctor, who I will have to see eventually, the kidney doctor, who I'm going to see at NUMC in their clinic, my endocrinologist, I only see her in telemedicine. The doctor who performed my male-to-female transgender surgery, I can only do telemedicine. My therapist and psychiatrist, I can only do telemedicine. And my support group, the one who runs the group, we can only do telemedicine. And my doctor who got me started in my male-to-female transition with hormones, I can only do telemedicine with her as well. I can't go out much. If I go out, obviously I wear a mask. But I can't take a risk. God forbid I run into someone with the coronavirus. My doctor said it would kill me. It's like I almost died in the hospital. So I really have to be careful. I have to monitor my blood sugar levels. I can't eat much anymore. Diabetes. I have to go on a strict diet for diabetics. I have to take insulin every day. Levemir. And I got persistent headaches. I'm aching all over. I took a nice warm bath today, which was relaxing. A bubble bath with fragrance. And I'm just hanging out, watching movies, doing some karaoke, take my mind off of things. And it's going to be a long road to recovery, but I'm going to try my best. I miss Matthew. We used to go out a lot, but it's better for him to be at the group home because I can't drive anymore. I'm very sick, so we couldn't do anything anyway. At least at the group home, he gets to hang out with the other residents there, and they have activities. The coordinators and the counselors have a daily agenda, and they stick to that. Their day program now is still closed because of the coronavirus, but I got a call that they're going to try to open it 2 days a week or 3 days a week in September, but that's not a definite because it depends on the coronavirus, and from what I understand, the coronavirus is going to get worse come fall and winter of this year and next year. So we're in for a long haul with this coronavirus. I wish you all the best. I'll give updates when I can, or I'll do some postings to social media. I thank you all for your support and good well wishes, and I am very appreciative. Stay safe, be healthy, love your family. This is Emily Iannelli. Thank you. Bye.